All right. Okay, so we're working on the neck this week, and so we're going to take a look at Rachel's neck and identify some surface anatomy landmarks. So I'm just going to get this down here so I can see kind of the ends of your clavicles. And right there I can just see the slightest shadows where your sternocleidomastoids are coming down and that sternal head is coming over here. And then there's sort of another line over here that might be some of the platysma fibers that are, oh, there they are. They're popping right out in there. That's great. Now, if we kind of move into palpation, it's really easy to palpate the sternocleidomastoid. That's a nice, easy identification from the anterior side. And just when you're practicing palpation on each other in the neck, just err on the side of gentle. This is an area that can kind of hurt if you're pushing too hard or poking too much. So very nice sternocleidomastoids, piece of cake. And that's the muscle that divides our neck into the anterior triangle and the posterior triangle. And most of our massage work that we'll do in class is going to be more focused on posterior triangle, or even more the full posterior part of the neck. There's less musculature in the anterior triangle, so there'll be less massage there. But let's take a look at some of the viscera that are there, because they're certainly palpable. So probably the easiest place to start is to start high and try and identify the laryngeal prominence, or the Adam's apple. And if you have a male partner, it'll be easier, because it'll probably be a little bit bigger. But if you have a female partner, it's definitely very visible, or definitely very palpable. So there is the location of the laryngeal prominence, part of the thyroid cartilage. I guess that's a helpful medical landmark because that's the location of the bifurcation of the carotid artery. So if you went straight over and you felt right into that space, you'd get a very strong carotid pulse. If we go down from the laryngeal prominence, there should be there it is. There's just sort of a dip, and that's the cricothyroid membrane in between the thyroid cartilage and the cricoid cartilage. How am I doing on pressure? Are you okay? Okay. And then right below that is the cricoid cartilage, kind of a big bump. And then right below the cricoid cartilage, we'll get to the trachea. And if you keep going down the trachea, it will feel similar, like because there are cartilaginous rings, but then there's a point where you feel soft tissue instead. That's right underneath your finger. And that's where we're feeling the thyroid gland. It's not as distinctly palpable. It's not like you can feel every lobule of the thyroid, but it's a point of transition between the cartilaginous rings of the trachea and softer tissue on its anterior surface.
So if you push the thyroid gland back and forth like this, I think then you can, if you're pushing with this hand, you can feel it over here.
Great.
And if you push over here, then you can feel it over here. Does that feel comfy for you? Good.
Okay, well, I guess the other landmarks that we have from this point of view, we've talked about the viscera in this area. There is a hyoid bone, like way up in there. Now this one does kind of hurt if you really go for it. So you got to be real gentle when you're up in this space, but it's almost like you're kind of feeling up towards the floor of their mouth and then down. And then that's where you'd feel hyoid bone. And just, if you're at the laryngeal prominence, just go up about a finger's breadth and you're probably right about there. In this area, in the back, right underneath the partner's ear, you should be able to find a mastoid process. And again, if you aren't sure or you feel like everything around there feels the same, use the sternocleidomastoid. It'll point you right there. It's in the name.
Indeed.
There it is. And mastoid process isn't just the attachment for the sternocleidomastoid. There's also several muscles from the back of the neck, and even longissimus attaches clear up there. So pain in this area might tell you more than one thing. So I guess that's about it. Maybe external jugular vein. I can kind of see a shadow of your external jugular right here.
Yeah.
You could also enhance that if you have the patient do a Valsalva and turn their head to the opposite side. That would get that to pop out because of the blood pooling in that vein. I think that's pretty much all I've got to say.
Okay, when you are feeling for the mastoid process here, if you back your finger up just a little bit more, you might feel that little pointy, I think it's called the styloid process.
Oh, the styloid process?
Yes, and you want to be very gentle in that area,
Yeah.
because that's a teeny tiny little bone that if you're really wailing on it, you could do some damage, I suppose.
Sure.
All right. So the only thing I do about the viscera in the neck is move it aside so that I can massage the anterior scalenes that are attached to the anterior of the cervical transverse processes. So I would just ask you to relax your neck as much as possible and kind of slide in between the sternocleidomastoid here and the trachea, and then take a nice deep breath, please, Rachel. That's away. And then I just push that trachea aside and go straight down then. There I am. Did that feel comfy to you when I did it on the other side? Okay, so I'm putting my fingers in the same place between the sternocleidomastoid and the trachea, and then taking a breath. Thank you, good job. And just to move it aside, and then sink down, straight down, and you can just massage. I think I'm up on the cervical vertebra number 1, 2, 3, 4, 5.
You can also use
That feels funny, doesn't it, to have somebody poking so deep into your throat? People say so. But for people who sing, this can be really important work, or speech givers, people who use their voice a lot. This can be important work. Or if you have discovered that you can't help this neck feel comfortable, you've worked the sternocleidomastoid and all of the trapezius and all of those muscles in the back, and they are still uncomfortable in their neck, you may need to massage those anterior scalenes. And that may be the final key that lets that person hold their head up straight and feel comfortable. So.